Hi, my name is Ashley Mendoza, and I am one of the advisors at the BYU Pre-Professional Advisement Center for our allied health folks. And I've been asked today to be able to talk a little bit about our office, what we do, as well as about common professions that we advise for and how to accomplish your dreams of going in those directions if you are interested in these professions. So I wanted to go ahead and start by introducing our team. So this is Christina. She is our director of the office, and she primarily advises for our pre-law students, but she also works a lot with our pre-med students, other pre-health students, and you actually may recognize her face if you've attended our pre-health 101 workshop. This is David Kaiser, and he advises for some of our pre-med students as well as our pre-dental students. This is Kai Barnett, and she advises for our pre-med students, and both of these advisors are wonderful. This is Dr. Paul Kay, and he's actually really awesome. So he is a doctor by day and an advisor by night as a volunteer, and he focuses on helping students who want to get their MD, PhD, as he also is a pathologist and does that as his profession. And then lastly, this is me. I am our allied health advisor. So I advise for students who want to go the PA, PT, optometry, occupational therapy, podiatry, chiropractic, and pharmacy professions. So there are a lot of students we've served, as we have chatted about. We've got a variety of health professions that we advise for, as well as law and MBA. So in general, we do help students who are trying to make the decision, is this what I want to do? And we're happy to have that conversation. We also provide a series of workshops. So we provide the pre-health 101 workshop and 201 workshop, as well as in the future, when you end up applying to these various programs, we can help you with your personal statement, with interview tips and tricks, as well as application help. And all of our workshops are offered via Zoom, so it's really convenient. You can come at your own leisure, wherever you're from, even sometimes during your lunch break at work if you need to. We also can help you talk about courses that are specific for the professions you're interested in and talk about what it takes to become a competitive applicant. So for example, for medical school, you might need research and you might need to do volunteering and shadowing, and we can go into great depth with that. And then in the future, if you decide to go this path, we can absolutely help you navigate the application system and interviewing and talk about letters of recommendation. I'm not going to go over all of these, but these are the courses that we all teach just in our office. Or I should reframe that. We don't teach them in our office, but the advisors in our office all as a combination teach these courses as student development courses. I personally teach the Intro to Health Professions class, and that's one I really would recommend if you're trying to figure out what you'd like to do in healthcare. But we also have specific professions such as PA, dentistry, law, and medicine, if you're interested specifically on hearing from providers in those areas. So I wanted to start with a common question that we get in our office. What major do you think is best? And traditionally, if I were with you, I'd probably scan the room and see if you all have heard anything about the best majors for pre-health students. But the reality is schools really don't mind what you study as long as you complete the prerequisites. Now, I know there's still some students who say, I know, Ashley, but what should I major in? So typically my advice for you all is you really want to focus on your interests and your passions, as well as your skill set. What gets you up in the morning? I know for me, I really love connecting with people and chatting with people. And so for me as an advisor, it's a really great profession as I'm able to do that every day. But you also want to think about what's required in the major. If you're a pre-health student, it's probable that you'll need a lot of courses that are science related. And as a result, a lot of our pre-health students just naturally gravitate towards majoring in something in the life sciences, which is definitely an option. But I also have a lot of my pre-PA students as an example. I have a student who I was working with yesterday who is a history major. And I had a student who I was working with last week who's an advertising major. And I have a student who I worked with a couple months ago who is a musical performance major. So even though a lot of my students happen to be majoring in exercise science or biology or cellular biology, there's still opportunities to major in something different if you desire. And I think that's a really important segue to also mentioning that just because you major in something different does not mean that it will make you stand out. I've had students who have told me, hey, Ashley, if I major in economics, do you think it'll help me stand out in the PA school application? And I say, well, technically, no, but technically it could, right? And the reason I say that it could is if you study economics and then you join the economics club, and then you also get an internship in economics, that is evidence for you really being interested in that subject and you're doing things to engage and involve yourself. Now, the same could be said about any major. So that's why it's really important to choose something you're interested in, okay? So now I'm going to go over what I call the PreHealth Checklist. Regardless if you're interested in pursuing the health professions, even law, MBA, or even other things, I think this checklist can still be useful as far as navigating your time here at BYU. The first is making a plan for prerequisites. There are often prerequisite requirements if you want to go to graduate school. And this isn't just for pre-health. This could be if you want to get a master's in social work, if you want to get your MBA, or if you want to get a master's of history, in addition to if you want to go to medical school, PA school, etc. So there are some professions that it's pretty cut and dry. Whatever you like, for example, with medical school, it's really often simple to navigate because they have an exam that's required in order to go to medical school. And because they have that exam, it really standardizes the requirements for medical school. However, if you're one of my pre-PA students, love my pre-PA students, but sometimes it's a little bit trickier to navigate, and it really depends on the school you're looking for. So I always tell my students, especially if you're a freshman, sophomore, the earlier you can start looking at requirements, the better off you'll be in your academic planning. The second is seeking volunteer opportunities. I think it goes without saying that part of being a student here at BYU is that catchphrase, right? Enter to serve, go forth, or enter to learn, go forth to serve, right? And so there is, I think, an understanding that we should be engaged in our communities, whether it's our wards, our Provo community, or even Utah County community. And I think one of the best ways to do that is finding opportunities to serve. So for graduate schools, typically, they're always looking for students who have engaged in the community. And one way is through those volunteer opportunities. I also tell students, though, it's one way to learn if you really like what you're pursuing. So maybe you find a volunteer experience that you work with a community or population in which you might work with in the future. But volunteer opportunities don't have to be related to the profession in which you're pursuing. So I always give the example, let's say you really love kids, then find a volunteer opportunity that you get to work with kids. So that one, it's evidence to show that you like to work with kids, but two, it gives you an opportunity to engage because you need to do volunteering anyway. So it's a passion that you get to do. The third is finding shadowing opportunities. I think this is huge, especially for our health professional schools, as they typically require shadowing opportunities. And I always tell students it's twofold. It is evidence to show schools that you have a good idea of what you're getting yourself into. And for you, it's a great opportunity to see, do I really like this, right? Do I like what I see? And does it give me the umph I need to continue on the path of doing all of these things? Fourth is participating in research. Now, what I will say is not every profession requires research or views research in the same way, as well as other professions outside of the health professions. But I think it's a great opportunity to gain skills, right? How do I work on a team? How do I connect with professors and develop those relationships? So if you have opportunities to participate in research, BYU is a fantastic institution to be able to give you opportunities to participate in research. The fifth is gaining healthcare experience. And if you aren't a pre-health student or interested in health professions, I would say substitute healthcare with whatever experience you're hoping to gain as far as something helpful to build your resume. And that's exactly why I would recommend it. If you're a pre-PA student, they require a lot of healthcare hours, right? So you might be working as a CNA or a phlebotomist or a medical assistant. But even if you're interested in pursuing advertising, for example, maybe you go and get an internship with an ad agency. And all of those experiences will help you not only build your resume, but give you the teeth that you need when you graduate and you apply for your variety of programs or jobs to show them that you've got some good experience. The sixth is taking respective exams. So for a lot of the health professions that we advise for, there's the MCAT, which many of you maybe have heard of. For medical school, there's the OAT for optometry, the PCAT for pharmacy, the GRE actually for a lot of my programs like PT or physical therapy, occupational therapy, PA. And the GRE is actually really common for graduate school in general as well. So make sure that you're aware, whatever path you're wanting to pursue for graduate school, whether it's in or without the health professions, that you're aware of any preparation that you might need and how much weight it might have on your application. The seventh is gaining leadership opportunities. And I always tell my students, work smarter, not harder. So you technically don't need to seek a leadership opportunity outside of what you're already doing. And my suggestion is find what you're already doing and find ways to make positive impact. What can you do to help train perhaps new employees after being there a semester or two? Or what can you do as a club member to then eventually become a leader in the club leadership? But find meaningful ways to make a difference wherever you are. The eighth is to meet with an academic advisor to make a graduate plan. Now, something really important to recognize about our office is we know a lot about the prerequisites you need to take. However, we are not the experts on all things major related. And so it's really important to work with our office as well as your academic advisor. And the way that I see it is we're all on a team. We're here to support you and be your cheerleaders, and we just have different roles and responsibilities, even though sometimes they do overlap, which for some students can be a little confusing. But our office, specifically for pre-law, pre-MBA, and pre-health students, we can go over prerequisites, and then your academic advisor will help you know when you're going to graduate and to make sure that you can graduate, which is super important, as well as be awesome mentors. Rule number 9 is to find individuals to write letters of recommendation. So throughout your time at BYU, you're going to work with a variety of people. It might be a volunteer coordinator in the community. It might be a professor that you ended up being a teaching assistant for. It might be a professor that you did research with. On the flip side, it might be someone that you worked with as a CNA, the charge nurse or lead nurse, or maybe even the doctor who you were a scribe for. Perhaps you also have just a job on campus and your supervisor there. But I always tell people, kind of grow where you're planted. Find meaningful ways to make a difference wherever you are, because one, I think just general principle, it's always great to work with people who really want to be there and who are wanting to make a difference and work hard. But at the same time, though, you know, in the future, you may need letters of recommendation for graduate school, and you want to always have positive interactions so that the people that you ask for can have positive, but also quality things to say, right? So the more that you do, the more that they can speak about who you are. And rule number 10, it's really important for the health professions in particular, as well as law school, that you apply typically 14 to 16 months before you actually start the program. So the things that we've talked about today, making the plan for the prerequisites, volunteer opportunities, shadowing, research, all of those things need to be in a really good place by the time you apply, even though you're applying a whole year or so before you actually want to start the program. So these are just what I call the PreHealth Checklist, path to success. And regardless if you're going the pre-health route, I hope you are able to see how some of these things can be helpful. Just as a small anecdote, when I came to BYU, I was a pre-advertising student, and that was what I thought I wanted to do. And long story short, I had, you know, a strong feeling to switch majors, which was really confusing to me at the time. And what I realized is if I do this major, I really need to pave the path for myself. And so I did internships, I volunteered, I really got involved to the point where it helped me then find the career path that I have now. And so all of these things aren't just a checklist, right? Although the irony is I have it called the checklist, but really I think there's a deeper meaning than that. It's the process of becoming, it's the process of getting to know who you are and how you can then make a difference where you are, as well as in your future careers and capacities, okay? So we're going to switch gears here, and I'm going to talk about some of the professions in which we advise for and some information about them. So the first one is a doctor or physician. So many of you, and I would probably say most of you, have seen a doctor at some point in your life. And a doctor, physician, uses medicine to treat illness and injuries to improve a patient's health. So the really cool thing about a doctor is it's not only about the disease, but it's also about the interactions you have with people. You're having meaningful relationships and connections, and also talking about how they can improve the health that they have. And so the way that you do that is examine patients, diagnose, and treat. And there's a variety of specialties. So many of you have probably seen a family doctor, but there's anything from dermatology to ophthalmology, emergency medicine, surgery, and the list goes on, which is really exciting. Now, one thing to know about becoming a doctor is typically the first 4 years you're in the classroom. And then after that, you have what is called residency. And residency can really vary depending on what specialty. For example, if you're doing family medicine, that residency is going to be a lot shorter than if you're doing cardiothoracic surgery. And the reason is just the specialty and degree of information and, I guess, risk that's involved. So you really want to be really well trained if you're dealing with the heart versus as a general provider. Now, there's also fellowships that you could do in the future, but medical school is a fantastic path if you want to treat patients and become an expert in the area in which you are hoping to treat patients, the capacity you're hoping to treat patients. Now, the path is long, as you can see, right? At minimum 7 years, could be even 11 plus years, but it is really rewarding if this is what you want to do. So going back to the previous slide, when I talked about shadowing, that's why those opportunities are so important for you to really see, is this what I want to do? And that student development class we have, the preventive medicine, can be a great resource as far as hearing from different providers who are physicians and seeing if you like it and if you're interested in it, but it's a great path. Second is a dentist. So many of you, probably most of you, have also visited a dentist as well. And what they do is they evaluate the overall health of patients while advising about oral health and disease prevention. So some of you, like myself, had braces once upon a time, and we all did it together in middle school, and it was a great time with all the colors and the rubber bands you could choose. But the reality is dental health is really important in our overall health. And so if you're really interested in dental work and teeth, but also I would include dexterity, right? Using your hands. And I would also add creativity, right? There's a lot of creativity that comes with dental care as a dentist. So if you find that you're interested in those things, as well as perhaps business, maybe you want to own your own business one day, this is a really great path. Dental school is 4 years. And then if you do want to specialize, like for example, become an endodontist or an orthodontist, typically takes an additional 2 years after dental school for that training. Physician assistant. And really, I should change the name because earlier this year, it got changed to physician associate. A lot of people think of a physician assistant, or commonly known as a PA, as a doctor's sidekick. But in reality, they are a very autonomous, really awesome healthcare provider. And I get really excited about this profession because it's the one that I advise for the most. But the really cool thing about a PA is they can diagnose, they can treat, they can prescribe medications very similarly as a doctor. In fact, they can even participate in surgery. And there's a ton of surgical PAs that exist as well. Now, because the schooling is a lot less than a physician, there are limitations to what a PA can do. And it's not, so if you're a PA, I always tell students, the buck doesn't stop with you. You have a built-in support system with physicians to consult with, or have them make some of those decisions. But I always tell students as well, you probably have met with a PA and you didn't even know, right? They are very competent providers, and they can actually work in almost all specialties, if not all specialties, depending on the state that you live in. Now, the unique thing about a PA, as a physician, you specialize. So you might be a dermatologist, and that is the hat that you wear as a physician. However, as a PA in your career, you might work as a dermatology PA, and then 10 years later, you want to pivot to emergency medicine. You don't have to do anything different to be able to make that switch, which for a lot of my students, it's really attractive. Okay. Podiatrist. So one thing I will say about a podiatrist is a lot of people have this misconception that it's just a foot doctor. However, they do so much more than work with feet. In fact, their specialty is the knee on down, and they are considered a doctor. So what I always tell students is, if you know that you're interested in working with the lower extremities or the knee on down, then podiatry should be something that you consider, because Unlike medical school, you go to medical school and you don't know what your specialty will be until you take your board exams and you really see how you perform. So while there's a great chance you can get the specialty that you want to as a physician, it's not always guaranteed. Whereas a podiatrist, if you know that you're interested in working with the foot, ankle, lower leg, then it's a guaranteed specialty that you'll have as a podiatrist. And podiatrists can do surgery, they can do orthopedic and sports medicine. They also work with diabetic patients and different foot disorders, diseases, or injuries. And I talked about already that they can, perform surgery and administer medications, prescribe PT. It's typically 4 years in medical school. And in fact, a lot of podiatry schools, their first couple of years, they're actually with the medical school students in class, which is really exciting. And then they typically have 2 years of residency. Okay. Physical therapy. So many of you may have had an injury in your life and visited a physical therapist, but their purpose is to help patients restore function and improve mobility. So just as a quick anecdote, my last semester at BYU in my undergrad, broke my leg skiing, and it was one of the most painful experiences of my life. However, I had an amazing physical therapist that helped me with rehabilitation, and that was fantastic. And what that did was that helped me relieve that pain, prevented and limited permanent disabilities. And luckily, my broken leg wasn't anything severe, but there can be injuries that can be very severe, and they can help limit those permanent disabilities or even prevent. Physical therapy is 3 years and it's a doctorate. So it's called a DPT, so Doctor of Physical Therapy. And there's actually a lot of different specialties within physical therapy. You can become an outpatient orthopedic physical therapist, which a lot of times when students think of physical therapy, that's what they think of. But you can also be a pelvic health, physical therapist, or neurology physical therapist. You can work with pediatrics, hospital, etc. So the list goes on. And I would encourage you, if you're interested in physical therapy, to explore some of the different opportunities that you can pursue within physical therapy. The next career path is optometry. So if you are interested in the eye and how it works, optometry is a really great profession. So they typically are the primary healthcare providers for the eye. And what that means is, the example, I guess, that I would give you is if you go to the doctor, you've got a cold, that's like your primary care doctor. But if you have something very specific, like maybe you have your heart is having a different rhythm, you might need to see a cardiologist. I would say something similar would be for optometry. If you have just general eye care, you need glasses prescribed, your optometrist is the one that you'll work with. Or maybe you have dry eye and your optometrist will work with you. But if you have, diseases like glaucoma or you need LASIK surgery, then that's when you would work with an ophthalmologist, which is an eye doctor who goes to medical school. So optometrists, they examine, diagnose, and treat patients, and they can even perform some small surgical procedures. Not LASIK, but maybe something smaller in the office. It is 4 years of schooling to become an optometrist, and there's actually a lot of different things you can do with it as well. One of the most popular, specialties within optometry that our students really enjoy is vision therapy. So almost think of physical therapy, but you do exercises for your eye to strengthen the eye. So it's a really great profession. And if you're interested in it, I would encourage you to explore it. Occupational therapy is another profession. And in a lot of ways, it's similar to physical therapy, and yet there are some major differences. So what they do is they help people across the lifespan do things that they want and need to do through therapeutic use of daily activities. And daily activities talk is very common within occupational therapy. Their goal is to help you get back to your everyday activities. So if we go back to my anecdote of breaking my leg, I had a major surgery. And one of the first people that I remember talking to was an occupational therapist. And they said, Ashley, you live in a place where you're going to have to climb stairs in your complex. So let's practice going up and down the stairs and working on your gait, right? Heel toe, to be successful. And Ashley, you live in a, apartment where the bed is really high. So we're going to have to learn how to, put your leg up and off the ground to be successful. And while that sounds perhaps silly, for me, that was life-changing. I had so much confidence going back to my apartment and knowing that I could be successful going back to my everyday living activities, because that was totally changed from breaking my leg and having, a big cast. What they do, though, is they enable people of all ages to live to life to the fullest. And that's the interesting thing about this, or about occupational therapy. So it's not just about the physical ailments that patients are experiencing. They also may address mental health, some of the social impacts. And sometimes, as an example, a patient might not be able to get back the physical capabilities that they did. And so it's, how do you work in your new reality? How can you still be successful? Occupational therapists often work with individuals with autism. And, I can think of, a experience where an occupational therapist told me that she worked with a kid with autism in school, and her goal was to help him be successful in class. So there's a lot of different ways in which you can engage with patients as an occupational therapist. So there's actually 2 different degrees, graduate degrees in occupational therapy. The first is a master's of occupational therapy, and the second is a doctor of occupational therapy. And that really is called an OTD. And right now, there isn't a lot of teeth in saying that the doctorate is better than the master's. So if you want to practice and simply just focus on working with patients, a master's is great. But if you want leadership opportunities, potentially running a clinic, doing research, or even maybe teaching adjunct, a doctorate would be a really great option for students. Okay, pharmacy. So, when people think of pharmacy, they often think of CVS or Walgreens. And while retail pharmacy is one element of the pharmacy profession, there's so much that you can do. So typically, pharmacists dispense drugs prescribed by physicians or other healthcare providers, and they also monitor patient health. Now, what's really interesting is in the field of pharmacy, one area that's really booming is it's called clinical pharmacy. And so oftentimes now at hospitals, pharmacists are part of a medical team. So you've got a doctor, perhaps PA nurse, and then also pharmacists, and they can kind of give their expertise and 2 cents on the medications that would be appropriate for the patient, which I think is really great. And that's one thing that healthcare is really moving toward, is collaborative healthcare. So each provider really providing their expertise for the benefit of the patient. So they can also advise physicians, other healthcare providers on doses, selection, interactions, side effects, etc. And pharmacy is 4 years of school. Okay, the chiropractic. It is a great field. And one thing that I'll add just off the bat is, if, again, you are interested in owning your own business and practice, chiropractic is a really great profession. Now, there is a lot of emphasis on the inherent power of your body to heal through manipulations, right? And manipulations being the use of your hands without the use of medication or surgery. So they typically focus on the relationship between the body's structure and function, and how that relationship affects the preservation and restoration of your own health. And so if you find that you really want to practice medicine, but one of your concerns was, I want to do it in a way that is more natural and with less, for example, like I said, drugs, surgery, any harm to the body, then this might be a really great profession for you. We have a lot of great chiropractors in the area and a lot of great pre-chiropractic students at BYU. And there's also a lot of different philosophies within chiropractic. So I always tell students, you can find the right fit for you if you're interested in chiropractic, whether it's more to the true initial beliefs of chiropractic, or maybe some of the more evidence-based practices, or anything in between. Okay, and then also law. So switching gears from pre-health to law, our director, Christina, is definitely going to know a lot more about law than myself, but it's important to know that there's 2 different kinds of attorneys. There's the litigation attorneys and there's the transactional attorneys. With litigation attorneys, they typically work on cases. So those are the ones that you might see more on TV and how it's portrayed there. So they're headed to court, whereas transactional will typically work on transactions like business contracts, estate planning, adoption. So some examples of that might be LeBron James's contract, right? The legality of drones. And, I don't know if any of you are maybe old enough to remember this, but typically they used to have, like, for wedding videos at temples, drones that would go over it. And then now you see that it's not as legal anymore. And that all deals with law. Chick-fil-A's nugget recipe. Honestly, I really want to know their Chick-fil-A sauce recipe, if I'm being honest. And then Kim and Kanye's prenup. They just got a divorce. So that would be really interesting to see, the transactional law that would go into that. So for law school, it takes 3 years. And BYU actually has a law program, which is awesome. Unfortunately, they don't have any of the other health profession programs that we talked about, but we do have a law school. And The nice thing about the law path is there isn't a major, there are prerequisites. They just have you take the LSAT, which is the exam that's required, and hopefully doing well in school and then coming up with your personal statement and application. But it's a great profession, and our director, Christina, like I said, is the expert on it and would love to talk to you if you're a pre-law student. So kind of what I wanted to end with today is branding. So whether you're a pre-health student, pre-law student, pre-MBA student, or if you're just along for the ride today, listening to this presentation, what I would love for you to take away from today is this idea of branding. What is your story? What do you want to be remembered by? As I mentioned earlier with the example of the volunteer opportunities, everything that you do is evidence for the story in which you're telling. So the advice that I have, be involved, participate in things that you're excited about, that give you passion, that give you joy, and that help you feel like you're making a difference. So be purposeful in the experiences that you pursue. Instead of doing a lot of random things after, initially doing the exploration and figuring out what you'd like to do, be purposeful in the volunteer work that you participate in, the internships, the extracurricular activities that you do, because truly that will help you pave and trailblaze, the path that you're hoping to pursue in the future. So that is what I have for you all today. I'm going to pause my share here, and I did want to show you our office website. So let me go to it here quickly. And the website is ppa.byu.edu. Let me go ahead here and share. And on our website, there are a variety of ways to make appointments with us advisors. So first, if you scroll down past services, on the left-hand side, you can make an appointment with one of us advisors. So you click on that box and you can see all of our photos and how to make an appointment with one of us. Now, currently we are doing a mixture of Zoom, in-person, and phone appointments. However, we are not in the office every day. And so because of that, there isn't a clean way to have in-person as an option. Because if we had if you made an in-person appointment, but we were out in the office, we were not in the office that day, then it would be challenging. So the way that we do it is if you click phone or video chat the day of the appointment, if we're in the office, we'll let you know to have that as an option. But we offer Zoom and phone, and you would just click the name of the employee. So if it was me, and you wanted to do an in-person, I'm in the office Monday, Thursdays, and Fridays. So I always tell my students, if you prefer that, you can choose those days. But if not, I do video and phone as well. And then you just put your email address, your phone number, what area you're interested in, and what you're hoping to chat about, and then some information here as far as details to help us prepare for the appointment. In addition to that, we also provide a series of workshops that are really helpful. So under services and PPAC workshops, you can click the Google Calendar here. And when you do the Google Calendar, it's going to help you see all of the events that our office provides. So our walk-in times and days are listed here, as well as the workshops. If you're a pre-health student, I would really, really encourage you to attend pre-health 101 and pre-health 201. I always tell students they will bring you light years ahead if you attend them before meeting with one of us advisors, because we will be able to jump in and start talking about your needs versus giving you some general information about what it means to be a pre-health student. So I hope that this was helpful for you today and that there's something you got out of it, regardless if you're pre-health or not, or pre-law or not. But please come see us. We would love to meet with you. I know that I get really excited when I get to meet with you all students. And so let us know if there's anything we can do for you. My information is, or my email is Ashley, ASHLEY_Mendoza@byu.edu. Feel free to reach out. But like I mentioned, the best way is to meet with me so that we can then talk about you and your plan, or any of our other advisors. I hope you have a great semester, and thank you so much for giving me the time today to talk more about our office and some of the health professions and law.